Weekly jobless claims came in better than expected, with more Americans heading back to work, but the numbers are still historically high. 1.5 million Americans filed for unemployment last week. That's according to the Department of Labor. The number of claims dropping, though, for a 10th straight week. NBC News business and tech correspondent Ling is joining me now. And Joe, is it fair to say we are starting to recover? I think it's a question a whole lot of people have right now.
Yeah, recover is a strong word because we still see historic highs, as you were just saying. And so when you have 1.5 million jobless claims filed in just 1 week, that is certainly not normal. So yes, the numbers are improving, but a recovery would be a strong statement, especially after we see that it's now 44 some million claims that have been filed over just the past 3 months. If you take a look at the Labor Department report in a little bit more detail, and we dug into it this morning, you see that 21 million people continue to collect unemployment. So that number also improving, but still really, really big. And the states that have been hardest hit are your usual suspects here in California, New York, Florida, and Georgia. But this ongoing situation is likely to continue. We do see layoffs continuing, although maybe not as bad as they were a couple of weeks ago or a month ago. But you have major retail hemorrhaging going on right now when it comes to stores closing, like Zara announcing they're closing 1,200 stores worldwide. You have some major jewelers like Kay Jeweler and Jared saying they're closing 150 stores here in the U.S. due to COVID concerns. So the layoffs do keep coming, even though you do have a return to work and so many states. But this discussion of a second wave, as you were just talking about with Katie Beck, certainly has a lot of companies stepping back and thinking, okay, what's coming next?
Yeah, Joe, certainly rattling companies, rattling the markets. You mentioned retail as one of the sectors that's really still struggling the most. Which sectors are struggling the most along with retail? And where are we seeing some of the jobs starting to come back?
Yeah, well, we're seeing some jobs come back in hospitality and food service, restaurants and things like that. But across the board, you really do see a continuing pain, if you will. And when you look at the jobs report from last week that covered the month of May from the Labor Department, you do see the encouraging sign of people going back to work, but you still see disproportionate hit on the African-American community, women also being disproportionately affected by unemployment here. So the pain is really across the board, Allison.
Joe, Federal Reserve Chair Jay Powell was talking about our economic recovery this week. What has he been saying?
Yeah, he's saying it's a long road ahead to recovery. He says there's no plans. They're not even thinking about raising rates this year. So you can expect those to stay where they are. But he did expect that a lot of the jobs that we've been talking about that have been eliminated aren't necessarily going to come back. And so this recovery is likely to take years. And Fed Chair Jay Powell also saying that GDP, he expects the productivity of our economy to be more like to contract by 6.5% this year. He does expect unemployment to improve off of what we saw in May. So instead of being at that 13% level, it will drop down to 9-something%. But Fed Chair saying basically we're in a very dire situation, even though things are improving. So they're girding for the long haul and doing everything that the Fed is able to do to keep things as not as bad as it otherwise would be, Allison.
Joe, some Americans are still waiting for their unemployment benefits, but we're also hearing reports that some people are being overpaid. Do we know what's going on here?
Yeah, there's been reports of overpayment in Florida. There have been issues of payment that people were applying for that they got, that they qualified for, that they are now having to return in the state of Ohio. We're hearing issues also in Washington state. It's very reflective of the issue we've been reporting on all along, the antiquated systems and software inside these unemployment offices and these labor departments statewide that need help. And so it's an overwhelming of the system that's never been seen before, of historic proportions. And so as a result, you have a lot of issues with not just the system itself, but now overpayment. So it's certainly a struggle for those who are already waiting so long for their unemployment, and now they are being asked to repay what so many thought they were totally qualified to get.
Joe, Republicans and Democrats can seem to agree on whether to extend that $600 federal unemployment benefit. Do we know what the key differences are in their proposals, where they're just unable to see eye to eye here?
Yeah, the Democrats have passed a proposal already in the House. And so what we're seeing now is they want to extend that till 2021. And Republicans are staunchly against it. There have been discussions bandied about when it comes to what kind of bonuses can be provided or different ways to supplement. There's been ideas of offering a bonus if you do go from unemployment to getting a job again. But this is a really intractable debate right now, because as we do see numbers improving on the jobless claim front, it's clear that we're still dealing with a massive case of unemployment and economic damage. There isn't going to be that V-shaped bounce back that members of the administration were hoping for. And so there continues to be a lot of tension there as people on the ground, voters, are thinking, look, I just need a little bit more help to get through my next month rent payment or be able to buy my groceries. Because even though we see this silver lining, the people who are actually being affected are still feeling a deep and acute economic pain.
Absolutely. Joe, silver linings definitely don't pay the bills. Always love talking business and the economy with you, Joe. Thanks so much for being on.
Thanks, Allison.
For more on the coronavirus, NBC News medical correspondent Dr. John Torres is here. Dr. John, great to see you. So more than 2 million cases in the U.S. so far. Now the director of the Harvard Global Health Institute is warning that we will cross 200 deaths by September and still won't be done here. A lot of people thought that when the country started to reopen, it was a sign the coronavirus was fading. Is it?
And Allison, great to see you as well. And I think that's the big misconception people have. And just to clear it up, the reason things are opening up is because we need to jumpstart the economy. We need to try and get people back to work. We need to try and get money back into the economy. It did not open up because the pandemic's over or things are much better. We can relax. Things are better. But what we're seeing, too, is something we knew would happen. This is what Dr. Ashish Jha has been talking about. And I actually talked to him last week on Facebook, and he mentioned the same thing, that this is going to be an increase in cases over the next couple of months. And unless we get that under control, we could see another 100,000 deaths between now and September to bring that total up to about 200,000, which is not something any of us want. At the same time, people have to realize that we are opening up again so people can get out there and get back to work, get those things they need, but not because the pandemic is over. And that's the big misconception. We still all need to do those things that we know work. And you and I have talked about countless times, social distancing being number one about that. And again, just understanding that without anything changing between now and September, things are going to get worse. And then come September, we're going to start looking at that second wave moving in, which could even complicate things even more. And with the flu on top of that, it could really lead to a bunch of issues that we're going to have a real hard time handling. And so it's incumbent on a couple of things. One, the public health departments and the government to try and help us control this. But it's also incumbent on us to make sure we're wearing masks. We're doing the social distancing. We're washing our hands. Even if we go out and about and do those things that we want to do when we're outside, we need to do them safely, Allison.
Dr. John, according to an NBC News analysis of cell phone location data, Americans are moving around and gathering at pre-COVID-19 levels again. Let's talk about that. And I know we may be repetitive, but it certainly is worth repeating. What is the risk here?
And you're right. It is certainly worth repeating. And the risk here is that people are going to start spreading coronavirus. People are going to start catching coronavirus. And we're going to be back to where we were a few months ago, which is back on that upslope of the curve we keep talking about. We have already started coming down as a nation. The problem is in a lot of states, Arizona probably being the worst example of these cases are coming back. They opened up. These cases started spreading. Now they're trying to keep it under control. To a certain extent, it's almost like trying to get that genie back in the bottle. You're trying to make sure that people either get back in their houses, shelter in place, or you're getting the contacts, the tracing that you can check and see who might be sick and who they were around, so you can try and make sure that you quarantine them. But regardless, something needs to be done along the lines here to make sure this doesn't spread. These spikes don't turn into outbreaks, Allison.
Dr. John, can we talk about potential treatments for a second? Regeneron Pharmaceuticals is saying that it's testing its coronavirus antibody drug on humans. What can you tell us about that?
So they're doing trials on humans right now. And just to differentiate a few things that people might have heard about, there's the convalescent plasma. And that's when somebody recovers from coronavirus. They donate their blood. They get the plasma out of the blood that has antibodies for coronavirus, and they give them to somebody who is now in critical condition to try and save their lives. This is different. This is monoclonal antibodies. And what they do is they look across the spectrum of antibodies. They pull a bunch of people's blood together. They filter out the antibodies they think are going to work, and they go ahead and try those in people to see if it can help fight coronavirus. Regeneron is doing something a little unique because some of the other trials are centered around using one antibody they think can help. This one's centered around using 4 antibodies, and they think that cocktail of the 4 antibodies will give kind of a jump start to people's antibody system. And this isn't a cure. This is something to help jumpstart their system until their own immune system can kick in and really fight. So it's just helping along the way there. But it's certainly one thing we can use, one more tool in our toolbox until we get that vaccine, which you and I have talked about is kind of the game changer we're looking for, Allison.
Yeah, that is really the thing that people are hopeful about and waiting to see. Dr. John, I know we often ask you the same questions over and over again, but as we've said, it definitely seems like they are worth repeating so that people understand just how serious this is and what we need to still keep doing. Thank you so much for helping us out here.
You bet, Allison.
Hey, NBC News fans, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.